Hello friends, welcome to BMH Learning. This video is about ACE level test. ACE level test is a blood test that measures the levels of ACE in your blood. What is ACE? ACE is angiotensin converting enzyme. So it's an enzyme that converts angiotensin 1 to angiotensin 2. Angiotensin 2 helps increase blood pressure by causing small blood vessels in the body to tighten or narrow. Why get tested? Or what is the purpose of this test? Or in other words, we can say, why is an ACE test is performed? Doctors most often use the ACE level test to diagnose and monitor a disease called sarcoidosis, and to help differentiate this systemic condition from other disorders causing similar symptoms. Sarcoidosis basically causes inflammatory cells called granulomas to form in the body, thus leading to organ inflammation. This condition affects a number of organs including lungs, kidneys, lymph nodes, liver, heart, and spleen. A classic feature of sarcoidosis is the development of granulomas, which is small tumor-like masses of immune and inflammatory cells and fibrous tissue that form nodules under the skin and in organs throughout the body. Basically, granulomas change the structure of the tissues around them, and when they are in sufficient numbers, they have the ability to cause damage and inflammation and thus may interfere with normal functions. When the test is ordered, an ACE test is ordered when someone has signs or symptoms that may be due to sarcoidosis, such as granulomas, chronic cough, shortness of breath, red and watery eyes, fatigue, fever, unexplained weight loss, night sweats, a loss of appetite, swollen lymph nodes, joint pain, dry mouth, nosebleeds. The cells surrounding granulomas can produce increased amounts of ACE. So this means the blood level of ACE may increase when sarcoidosis is present. So this is why a doctor may use the ACE level test to help confirm a sarcoidosis diagnosis or to monitor treatment for sarcoidosis. Your doctor may order ACE along with other tests such as AFB tests that detect mycobacterial infections, or you can be asked about fungal tests. This may help to differentiate between sarcoidosis and another condition causing granuloma formation. Your doctor may also use the ACE level test to assess the effectiveness of treatments for other medical conditions. One condition that may be monitored with an ACE level test is Gaucher's disease. This is an inherited condition that causes fatty acid substances called lipids to build up in cells and internal organs. Symptoms include easy bruising, fatigue, and bone pain. High levels of ACE enzyme can suggest you have Gaucher's disease. Other conditions that may cause lower than normal ACE levels include chronic obstructive pulmonary disease, hypothyroidism, cystic fibrosis, emphysema. Conditions that may cause higher than normal levels of ACE include cirrhosis, Gaucher's disease, psoriasis, amyloidosis, diabetes, HIV, histoplasmosis, hyperthyroidism, leprosy, lymphoma, tuberculosis. But you have to keep one thing in mind. For the confirmatory diagnosis of these diseases, along with ACE level test, other disease-specific tests are usually done. What do ACE level test results mean? An increased ACE level in a person showing symptoms consistent with sarcoidosis means that it is likely that the person has an active case of sarcoidosis if other diseases have been ruled out. ACE will be elevated in 50% to 80% of those with active sarcoidosis. But you have to remember one thing: a normal ACE level cannot be used to rule out the sarcoidosis because sarcoidosis can be present without an elevated ACE level. Normal ACE levels in sarcoidosis may reflect the disease is in an inactive state. Early detection of sarcoidosis. It may be a case where the cells do not produce increased amounts of ACE. Apart from this, ACE levels are also less likely to be elevated in cases of chronic sarcoidosis. If ACE levels start to rise even after treatment for sarcoidosis, this could mean that the disease is progressing or the disease isn't responding to treatment. In these cases, your doctor will work to determine a more effective treatment plan for your condition. ACE levels can also be low if you are taking ACE inhibiting medications such as captopril or Vasotec. This was all. Thanks for watching.